Okay, hi, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment where we know that meniscus tear is, and sure enough, it's right there extending out to the inner edge. Maybe a little bit of tearing in the posterior horn too. So we're going to have a look at this. This doesn't look like a repairable tear because of the way it's torn, like I said, all the way out to that inner edge. So we'll put a pair of scissors in. Hold the camera for a minute, please. And we will, no, this is good. And we'll trim this part right here. We're okay, we don't need it. No. And like we talked about in pre-op, we just take away as little as possible. Hold it right, Tech, so you can clean that. Okay, and don't worry about some of those loose pieces you see. Those will all be removed in just a second when we add a little bit of suction to this. We'll show you the instrument that does that, and then we'll come back up on the video in just a minute. So here's the instrument that has suction on it. See how those pieces quickly get evacuated. And then we can just kind of polish and fine-tune the rest of what we've been working on here on the meniscus. So we'll keep doing that and show you some more in a minute. Okay, we've trimmed out that tear. You can see what's left right there. You still got some posterior horn left and anterior horn. In terms of arthritis, the tibial plateau looks like it's in pretty good shape down below the shaver, but up above on the femoral condyle, you can see a little bit of roughness in the condyle there. Now, as we look to the central part of the knee, we'll find the anterior cruciate ligament, which is right here. There's a little bit of a fat pad there that's in front of the posterior cruciate ligament, but the ACL looks good. And then in just a minute here, we'll peek over in the lateral compartment. And at least initially, this anterior horn looks good. It's a little bit tight. I sure don't want to damage any of the cartilage there, so that looks pretty good there. So that's what a normal meniscus looks like. Okay. And then we'll look up at the patella in just a second here. Okay, so now we're looking at the patella. You've got some wear and tear changes on the undersurface of the patella at the top of the screen here. Nothing appears to be loose. And then as we look at the trochlea, which is the groove the patella glides in, here's where there's a large area of cartilage missing. You can see right there. And that can certainly cause symptoms when you're bending your knee or first thing in the morning or after standing or after sitting for a long time when you stand up. So you can see there, that's right in the trochlea where the patella normally glides. I don't really see any other loose pieces, so I think we've got all the loose pieces of meniscus removed. We can look over here in the medial gutter, flush that out. And then we can look over here in the lateral gutter as well. That looks pretty good too. So I think we're just about done. I don't really see anything else to do to smooth out the trochlea here. I don't want to really get into this fat pad because it's very vascular. And there's no reason to. Okay. Okay, so I think that's it. I think we're going to get you back to the recovery room shortly. Good luck to you now. Bye-bye.